the wealthiest man in the world and the poorest man in the world have absolutely the same amount of control over dying from a cardiac arrest, except that perhaps the wealthiest man has more data and the poorest man does not. So
one question as an entrepreneur and who's a startup, especially in something like Parkinson's, which people do not understand. The disease diagnosis is delayed. We have very few neurologists available in India. With all these things, it's a tough problem that you're solving. What motivates you to keep doing this every day?
well, I feel that healthcare is currently thought of as an afterthought. You don't think of it until you have an issue. And what I've learned from, experiences in my family and in general being immersed in that world is that this puts a lot of load on the doctors. Doctor is expected to be more or less always on, always present, always remembering these cases. I feel the onus of healthcare, it needs to be shifted to the person themselves. It needs to start at home. And I'm seeing a lot of encouraging signs in terms of wellness and fitness trends that go on these days. But we need to add another layer. We need to prevent these things rather than solve for them after. The wealthiest man in the world and the poorest man in the world have absolutely the same amount of control over dying from a cardiac arrest, except that perhaps the wealthiest man has more data and the poorest man does not. So what we want to do is level that playing field and make sure everyone has access to that preventive healthcare data before.